Start with the quality to order. This item, second item is to be minutes of June 15, 2000. For those of you who are here, please review the minutes. Change the minutes. Change the minutes. So, just change. Yeah. Drop the water to it. One more time. Yeah, any changes, comments, dates? 2 minutes. No, it's not. I move that we approve the minutes. Can I see that motion?
I second.
Second. You would have members to second.
Oh, I second.
Next item is number 3 is public comments. I don't know if anyone signed up for public comments. Sure.
So good morning, everybody. My name is Rosie Garcia, and I'm a regional coordinator for Partners Resource Network. And I was invited here by Ms. Jacqueline Rodriguez, so I'm very grateful and thankful for you all taking the time to have me come on here and present what our organization is about and the services that we offer to the community. So let me see. I'm just gonna click like this because I don't want to mess with it. Okay, so I don't want to like mess with it. All right, so Partners Research Network is a parent training information center for the state of Texas, and we are funded through the Department of Special Education. We do serve parents and children with disabilities from the ages of 0 to 26. And we do a lot of it's education. We're not advocates and we're not attorneys. We're here to help parents as well as youth and self-advocates to learn about the rights that they have and a bunch of different topics that we do cover. So our mission really is just to empower and support those Texas families as well as those individuals for them to become more knowledgeable about their rights within Texas and on different types of law, whether it's IDEA or the difference between the laws, the federal laws and the state laws that do protect them and serve them. We are here, as I mentioned, to serve parents of children that have disabilities as well as youth self-advocates between the ages of 0 and 26. We have 4 different projects throughout the whole state of Texas. So depending what area you're in is the project that you would kind of reach out to. I am out of Region 1, so we are in the lower part. I cover Laredo, Zapata County, Jim Hogg, as well as the lower part of San Antonio. And then I do have my counterparts that are like in the McAllen area, Austin area. Our main office is out of Houston. And then for the team project that I am a part of, our home base is in Austin, but we all do work remotely. So really, it doesn't matter who you reach out to. We will always find somebody that is in your area and we will get you to the correct person to be able to serve you. Here, as I mentioned, some of the resources that we do. Well, let me start off by saying everything we do is 100% free. All the resources, all the training, everything that we do is free. So we're here just as just to help anybody who's interested in knowing. We do also work with professionals. It's more limited with professionals. We're more for the parents and the youth. We do a lot of parent workshops. We do youth workshops. We do webinars. We give informational referrals. We do one-on-one technical assistance. We do help and support with the art process as well as IEPs. If you all are familiar with the IEP, right, which is the individual education plan. So we do get a lot of parents that aren't familiar with what it is, what is it saying. They're not sure if the goals are written the way that they should be written. So we do have a lot of curriculum and a lot of materials that we are able to teach the parent for them to know how to read those IEPs. They do send us the IEPs and I'm able to read that IEP. And then we provide feedback. Hey, this is where it's missing, or just we go back and forth. We do also attend art meetings as a support system again because we're not advocates or lawyers. We do a lot of annual symposiums, parent and youth leadership trainings, and we are on Facebook as well as on YouTube. And then, this is just something else. And then this is just my contact information. We do a lot of partnerships within the community here in Laredo. Unfortunately, a lot of people don't know about our services, and that's just unfortunate because they haven't had anybody in my position for a very long time. I just came on board in August of last year. So we had our counterpart in McAllen. She was having to serve all the McAllen area as well as Laredo. So Laredo's just been really underserved for a long time. So hopefully now that I'm here and I'm able to let the community know about our services, we are looking to do a lot more collaborations, partnerships. I know that I currently do have a collaboration here in Laredo with Miss Christine Reyes. And what we collaborated on was I gave her a list of the curriculums and topics that we have, which I did provide to you all in your packages. And we have different topics for just the general public, parents and caregivers, as well as a separate list for just youth. So we collaborated on doing webinars, whether it's 1 or 2 a month. She chose the webinars. We worked out the time and date, and then we just reached the community that way. So I do also have a collaboration out of San Antonio. So really, I'm just here to again let you all know about our program, and if anybody is willing to and wanting to collaborate with us, we're more than welcome to. Yes. Yeah, of course.
I'm not sure. I didn't hear it. Do you have a specific diagnosis of population?
It's any parent or
physical, emotional, people.
All of them. Any type of disability. And if we ourselves are not able to answer the question or help you, then we do refer you out to other agencies.
Yes, just so that you know, Vail is holding an ADA anniversary celebration as the leader of Vail Texas workforce. You might want to touch base with them. I can send you the link.
Yes, perfect.
It's going to be on the 28th, so it'd be a great opportunity for you to acknowledge your resources to the community.
Yes,
this is a center for independent living.
Yeah, perfect. Yeah, because we do a lot of tables. Like I'll go and set up my table and just give information. I've done it at TAMU, different events. Like I mentioned, I'm trying to get Laredo to kind of know who we are, right, and what services we provide because everything we do is 100% free. So, and it's we have a lot of great resources. With the ones that parents really tend to kind of gravitate to is going to be those IEP supports because they're not familiar with the law. A lot of them don't understand that there is a difference in how the children are protected if they have an IEP versus the 504 plan. So, I'm there to help educate the parents so that then they themselves can self-advocate. So, yeah. Any other questions? I did give you all my contact information, so please feel free to reach out to me and we all have a productive day.
Can you forward that email to us, maybe? I mean, that presentation?
Yes, of course. Yeah.
We do, I do employment services for individuals with disabilities. We work with that transition because we have students on the state right now is on transitioners. So that's a perfect bridge for gapping of services. So having that information with us would be very beneficial.
Yes.
To services.
And I did put out that package. I did put the curriculum topics and descriptions, and we do actually have some curriculum that I've done where it's transitioning like from high school to college and the differences, right? So we do have different curriculum on those topics of transition. And like I mentioned, there are some specific ones that are just for you that are transition and things like that. But yes, definitely, I will get your information. I can definitely send the PowerPoint to you all. You're welcome. Thank you.
Thank you, guys.
I don't know how to come it up. Thank you. You're welcome.
So you can send it to Stephanie or Steve for your presentation and we'll distribute it. Thank you for doing that today.
So if there's no one else for public comments, we can move on to number 4, which is introduction of new members. Last time we met, yes, Casares, right? Here. So the other person that was missing was thinking this tennis room.
Oh, yeah.
Okay, good. Finally get to meet. So, welcome. And thank you for participating in the group.
Thank you.
It's just longer than we expected. You all want to say something about yourselves?
Absolutely. Good morning, right? Still good morning. Good morning, everyone. My name is Denise Luna, and I work with TAMI. So that's why when she was mentioning TAMI, I'm trying to bring all of these resources for my students. I work with the Office of Student Counseling and Disability Services. So my office, what we do is we provide all mental health services and disability services for TAMI students. Of course, they have to be a student with a disability. So that's why I invited them, so they can, because some of my students, they don't know about all the services. They don't know about the VR program. They don't know about, resources regarding the community. Also, what we do at TAMIU, it's our goal from my office is, of course, to provide, the services for the students. And like I said, we do provide mental health counseling, professional counseling, and we also provide in the disability side, which I coordinate that side, is we provide academic accommodations for the students. So the academic accommodations is anything from having a large chair, from having preferential seating, from having extra time, in everything in order for them to have an equal access to higher education. So I know, I don't know why, but TAMIU was never involved with the community. I know LC was more involved, but now that, we want to, when we have in our meetings, we do want to be involved with the community because we know that our students, they need that support, that help, and especially since some of them may not qualify for financial support because they're exhausted once, because they take a little bit longer to accomplish their degree. So any resources available for my students, will appreciate it. But yes, that's where I'm coming from.
Welcome.
Thank you.
And just so that you know, I have a daughter that attends TAMIU. Okay. She's like very pushed a number of her friends to your office.
Okay. Bye. It is sad because sometimes I have graduate students that they're really coming into my office and they didn't know about, the services. Either because I don't know what happened between the transition from high school to higher education. I don't know. I mean, they participated in the area meetings, but I don't know what happened in that transition that they believe that once they graduate from high school, that's it. There's no more services available in higher education. So they're really knocking on my door as a graduate student. And all the undergrad, I was like, how did you do it? And I was like, well, I struggle a lot. But I mean, well, I don't know. I mean, but yeah, sometimes, I mean, or they have that stigma that, oh, they're gonna identify me, like in high school that they were in the special ed 504 program. And they don't want to continue like that, but I tell them, no, it's totally different once you're here. So either because they're under the stigma, they don't want the services because they think that we're gonna go into the classes and pull them out, like in high school. Like, no, we don't do that. It's just, it's, everything is on self-advocacy and, self-identification. And of course, we do provide a mental health counseling, but it's also at their own time. Like, we don't pull them out, okay, it's time for your session. It's whenever they have, their availability. And of course, we do, that kind of accommodations. But yes, I mean,
And just to clarify on that point where you say, students might not want the services, one of the things, our culture is an amazing culture. We are the people of the abrazo. And we nurture our children as they grow. So rather than empower them, we hinder them because we don't teach them to embrace who they are. We teach them to avoid what they can't handle. And while we are helping, we're really hurting students because then you have situations such as yours, where rather than having done a 4-year degree, now they're working on their 6th and 7th year. So I think outreaching the schools and letting them know, what, I'm here to provide a service. I'm here or partnering with VR or whatever other agencies out there and letting people know, what, we're here. It's about loving you today, tomorrow, and the day after. And I think that would make a difference. That has been my finding in the last 9 years. Prior to that, I was part of that product.
If I may add something, all schools need indicator 13 and 14. They have individual report cards that they have to submit to the state. So your type of job is essential for those transition service indicators 13 and 14. Just might want to mention that.
it's a little bit difficult because I know sometimes since we have early college, station at TAMU, so we do have a very close communication with early college, but when the counselors, they contact me, I'm gonna send you, Pablo Ruiz. Unfortunately, we don't work by referrals because in higher education, the student is to self-identify. So sometimes even though, and they're very good, it comes, I send you the ART records, the 504, I can't because I was like, the only thing I can do is provide my information. And like I said, sometimes they don't come to my door because they don't want to be identified as a student with a disability. So it's, it's a lot of, educating the students that it's their right, because I tell them it's your right as a student with a disability to receive these services. But I mean, it is also a close over there because sometimes, we don't work by referrals. It's even though they provide me with everything, if the student does not self-identify, I can't reach out to the student. And I have sometimes have 10 names of the students, and then, but right now I already have 8 students identified, only one out of the 8 for the incoming freshman for the fall semester. The other ones, they haven't. So, like I said, I don't know if it's more in the school district that they have to push the transition counselor. I don't know how that works. And just to say, hey, you know what? It's your right to receive the service. So, but yes, hopefully that changes. I'm gonna have a meeting from UIC. Yes, no, I was just mentioning. Okay.
You wanted to add, like, on the last time, came in at the last meeting that you attended the split a little differently because we had a large group here. So.
Is there anything else you'd like to add?
No, I know I saw my information in the minutes, so good morning to everybody. No, and I was just commenting to Ms. Nina, because of my background that and I do work in the special education department. Once you mentioned UISD, it would be wonderful to also reach out to our amazing counselors. We do have special education counselors at the high school, and they do work with transition. At our office, we also have a transition specialist who facilitates with the counselors, with the students. And the only reason I say that is because when I was in campus admin, I know I was in charge, I was in charge of SPED, but I did receive, when you said self-advocacy, some of our students did come to me that was trying to requesting their so that they could take them to the college. And they did it themselves, they came to me. So I thought when you said self-advocacy, well then some of the kids, or most of them I think are aware, but you make a good point, they might not want to take that step. Just
Discuss information. Item 5, we have a report from Christine Reyes, Special Needs Program.
Thank you. Just on 8 items that I would like to report from our program. The Family Supporting Community Resources, Children and Young Adults with Special Healthcare Needs. Our staff is collaborating to assist Police Department and Fire Department with the First Responders Registration Form. This will be utilized to register any individual into the First Responders Assistant Registry Program. This service will be provided at the Operation Border Health Awareness event with both PD and fire present next to our booth. Our program has successfully closed registration for the upcoming Inclusive Daycare Project workshop that we have on August 6th. We started a waiting list for the upcoming workshop with Brighton Center. We have provided 10 centers and 60 participants to attend our workshop for the August 6th Inclusive Daycare Project. Our program is assisting 30 clients with enrollment to a Kid Again organization. This organization's mission is to make life for families caring for a child with a life-threatening condition normal again by helping them gain back moments of positive family shared experiences and memories. The upcoming events that we are helping them enroll into is to include free admission and meals to Slitterbottom and to receive an adventure box project that is led by an art therapist from Texas Children's Hospital, Jen Sullivan. This is, of course, all thanks to the collaborative efforts of the Kid Again organization and Ferris Foundation that we partner. Our program will be hosting a virtual session of water safety for July 25th for National Water Safety Day. We have 35 families registered, and our program will be hosting a special needs planning, Medicaid waivers, SSI eligibility, and preserving benefits virtual session on July 27th. We have 78 families registered. There's a project from Texas Council of Developmental Disabilities that was shared with us. Its name is Your Best Shot Street Team Project. This will help provide accurate information about COVID-19 vaccines to Texans with developmental disabilities. They're monitoring COVID-19 situations and evaluating how it could impact Texans with developmental disabilities. TCCD's Best Shot Texas is conducting this short survey to better understand people's hesitations with becoming COVID-19 vaccinated. The survey will be shared via social media, and we'll also share it to everyone's emails. And the survey reports will be requested by our health department. Our program is also providing and sharing educational flyers via social media with emergency preparedness, water safety, and the COVID-19 survey flyer from Texas Council of Developmental Disabilities. And for our last report is we enrolled in the last 2 months 177 new clients, growing our program to 663 clients, which puts our program at 780% of clients served. She's getting there. But yes, that's my report.
Thank you so much. Thank you for the information. Next item is discussion with possible action regarding city council from agenda. Item agenda requested by city council and this is I understand that there is a presentation.
Okay, good afternoon, everyone. Some new faces. My name is Erica Martinez. I'm the Assistant Director here at the Health Department. I'm going to share some updates of the committee, what we've worked on. I know some of you are familiar with our background, and we have seen some activity and some directives from council in terms of what they would like to see for the population that we serve with this committee. So just going to give you a quick update. Of course, Christine provided her update on our Children with Special Healthcare Needs program that is housed here at the Health Department. We are doing the training for vaccine providers, as she mentioned, first responder registry form, the adaptive aquatics, and of course, we have just launched our multisensory room at Fasken. That program does continue now that we have finalized and opened and the grand opening for the multisensory room at Fasken. We are identifying locations in South Laredo to do the same for that region. We do have our BRC, just a little bit of background, especially for the new members. This committee has served since August 2010. It was created by motion, and it is mayor appointed with up to 12 members to advocate, of course, for those in our community with disabilities by promoting awareness, education, and securing resources for their physiological, psychological, and social well-being. And of course, to provide guidance and serve as consultants to the City of Laredo officials regarding issues affecting people with disabilities. I pulled this up from the original vision and mission that the BRC created back in 2010. So a little bit more about Blue Ribbon. Of course, we have our logo. We do count with a website. A couple of PSAs. I do encourage you, for the sake of time, I won't connect, and just to try to avoid technical difficulties, I won't link. But I do encourage you to visit the BRC website, and the homepage at the very bottom. There are the PSAs that the committee has worked on. The launching one was for accessible parking, and the most recent ones being hiring people with disabilities. These 30-second PSAs highlighted members of our community, youth in our community that worked with the private sector and provided a little bit about their experience, of course, with the collaboration with workforce in being designated with, I believe it was 2 local pizza shops. And of course, we do have our programs with other members of the community. The BRC has also led sensitivity and inclusivity trainings. I do encourage the committee to perhaps revisit that to see what options are available. Of course, the health department is your health department, so we'd be more than happy to host and have those trainings be reintroduced for the sake of spreading the education. And through the website, we also have links to resources available. Those are updated continuously. I know we receive feedback from members wanting to have certain information included in the website, and we work with City Secretary's office to update those periodically. This is a little throwback to when BRC met at the Sheriff's Center. The BRC did meet for a couple of years. I believe we were doing it like once a year. And of course, with COVID and everything, we stopped. But the center provides students with disabilities vocational training to integrate into the workforce. We've also participated with the Laredo Disability Alliance. We participated in their 2018 job fair, and Laredo Health was also a keynote speaker, and we shared a success story on our collaboration through this committee and through Workforce in their 2019 Business Symposium. One of my favorites, Summer Earn and Learn program. I'm happy to report that City of Laredo Health Department is once again a partner in this program. We do have 4 students that started mid-June and will be with us through the second week of August, obtaining work experience with our department in several divisions. We actually have a student in administration, in epidemiology, and I'm missing one, our primary care clinic. Of course, those that are familiar with SEAL, this is a collaborative with Workforce Commission and VR. And they do training, do work-based learning, and they get paid for it. So that's super neat as well. Oh, here's a picture of us. Real quick. With the students, and they're working 20 hours a week, so part-time during 12 weeks. There we go. We're also collaborating with the Adult Paid Work Experience. I'm really happy to report that not only the health department is going to be participating in this initiative, but also other departments within the city of Laredo. Again, a collaborative with Texas Workforce and VR for them to learn skills that are transferable to future long-term competitive integrated employment. And this is also a paid internship where Workforce provides payments and then they obtain work experience in various departments or organizations. So we are placing, like I said, there's going to be 2 customers at the health department, one with information technology, so IT, and one with building services this year. Brighton Center collaboration. We are working with Brighton Center in San Antonio. Ms. Christine has provided that report in the past, but we are gearing up for a visit to tour the facility in San Antonio and just provide networking opportunities of what we can see that we can bring back to our community here in Laredo. They're also assisting us with some of the training that Ms. Christine has mentioned. For the daycares, we are set to participate in August. We did see a very positive response from the providers here in Laredo wanting this type of training, so that's very encouraging. We filled up the list of participants in a matter of minutes, I think I heard. So now we're coordinating additional trainings for other providers within the upcoming months. And we're going to leave right after this meeting to San Antonio to tour, and we'll come back and provide a report for the next BRC meeting. Or visit. I'm getting ahead of myself. I apologize. Inclusive childcare training. I already talked about that. Sorry. So council directive. This is what we touched on very or somewhat in our last meeting. This is a directive from Councilmember Vanessa Perez of discussion with possible action to help improve quality of life through the creation of a coalition and a special needs master plan, of course, through the Blue Ribbon Committee. So some of the actions, we do have the graphic already created by our very creative director, Dr. Chamberlain. And of course, the title of it also, City of Laredo, All Kinds of Minds. We do have a very rough draft on what we kind of foresee the structure of this master plan. But of course, we will leave it up to the coalition, which will be derived from the Blue Ribbon Committee, and of course, other members of our community to finalize the details on what what this plan is going to house. So the first Autism Coalition meeting will be scheduled for August 3rd, 2022 at 11 here at your health department. We do issue out a warm invitation to all BRC members and all in attendance today to attend this meeting.
Sorry.
I'm sorry.
I said midnight.
11 p.m. a.m. Sorry, typo. I got too excited about the meeting. A.m. Yes, let's not do. It is going to be fun, but not at the party time of 11 p.m. It's 11 a.m. We've also finalized details for our first town hall meeting. Of course, this will be an open invitation to our entire community. The health department, with the support of council and management, will start issuing out notice of this town hall, which will be held Wednesday, August 10th at 6 p.m. I got that one right. At the Laredo Public Library main branch. So we did want a center location, and this is one of several town halls that will be scheduled for the community to partake in the creation of the master plan or any other issues that they might feel are of concern that they can bring to the committee and to council at that time. So this past Monday, we also received another directive from Council Member Alberto Torres requesting the following discussion with possible action to create a workforce employment program within the city of Laredo for adults with special needs and further incorporating the private sector and other matters incident thereto. We were ready to report. We actually had this complete presentation ready to provide to the council members. Of course, for the sake of time, we provided a brief summary and let them know that we are active participants in SEAL and the adult paid work experience. So they were very happy to know that we've already started a lot of these initiatives, but of course, with the support of council, we're looking as to how to further support, expand, and create more opportunities for people with special needs, of course, with the collaboration of workforce and all the other entities in this room. So we welcome your ideas. We also are thinking, Councilmember Perez did provide the guidance that perhaps it could be a subset of the Autism Coalition she asked to create. We see it as, again, also a subset of the BRC. So perhaps another subcommittee with people, subject matter experts on specifically workforce development would be critical in providing a full report or recommendations to council. Any questions?
Can I add something? Go ahead real quickly. I just want to thank Erica and Dr. Chamberlain for the initiatives the health department has taken in creating these initiatives. Without their support, and I'm being really honest because I'm on the receiving end of that, I'm on the waiting list of that, this would not happen. It takes people with passion and a vision to make things happen. And I can honestly say that the health department has been a trendsetter in developing the programs that are going to become forthcoming. So if anything, I think they would deserve a value.
Workforce Center years back, right? They've always been true advocates, so I second that for sure. True advocates of really being inclusive. And you know what? With these great programs that VR has right now, there's no risk to the employer. All we're asking is an opportunity, right? Give these people a fighting chance, and our community is a better place. So I applaud it. That's amazing.
Thank you. And we really appreciate the kind words. We work selflessly to ensure cooperation, diversity, equity, inclusion within, of course, our immediate umbrella organization, Laredo Health, going out into the community. But of course, we are working to ensure that City of Laredo, as the mother parent organization, is able to push this through. Since this item was put onto the council agenda this past Monday, council members did not know that these programs are in existence, that these pathways to industry do exist. And we wanted to make sure that we weren't taking the credit for them. So I can share that we just got a media request about this. It said you have to go to the parent organization, the Texas Workforce, to highlight them and then use the City of Laredo as a subset of how successful that it's working. So I'm glad that they're starting to place a spotlight on it, but it shouldn't just be spotlighted in the moment. It needs to continue to work as we're working and continue to build that strength. And so as Councilmember Torres did place it on the agenda, and we brought it to his, or we helped educate him on what we're doing here at Laredo Health and how it's trickling into the City of Laredo, other organizations, other departments, as we have, if I'm not mistaken, 34 different departments. So it's working its way into them. And we're very excited that it's health and two others as of this moment, and that it'll slowly roll into the rest of the departments to be able to bring in larger sets of persons coming into the SEAL program, the adult work experience program, and then seeking to find other pathways to be able to generate the experience that is needed for these individuals. And then it also has that advantage as the organization, the supervisor builds that rapport, sees the amazing work and productivity that comes out of anybody and these individuals as well, and rolls them into the opportunity to be a full-time employee at the city of Laredo. So, and as you mentioned, they said about price and how it costs us, the city of Laredo, and I make sure in the moment to say it does not cost us anything. We are giving gifts by partnering to persons with special needs.
Erica, I'm sorry, you mentioned that subcommittee for the Coalition for Access to Autism Services.
Yes, ma'am.
You're gonna be forming a subcommittee, because there's an individual that reached out to me from the other meeting that we had that was very interested. So if you would just let me know, and I'll put her in contact with you.
So,
Sure. So that would be the first meeting scheduled at 11 a.m., guys.
and they're definitely welcome to join in as many
Let me
persons
change that.
from the community that would like to. We do also want to continue to stress the subject matter expertise that is
Yes.
sitting around this table, and we cannot do anything without the SMEs here. So we do encourage, of course, any type of representation from BRC, which of course will be us, Health Department, Erica, myself, Christine. But the subject matter expertise are going to help drive the All Kinds of Minds master plan. And within that, I just have subsections just to give you all a little bit of background, or it has background. It has vision, it has mission, it has goals, it has objectives, measures, indicators, and benchmarking. They're all blank right now because we do want that to come as a collective input to be able to develop this document. By no means do we want it to be 99, 60, 45 pages long. We want it to be roughly about 20 with appendices that make it really nice and easy to read for a family member, or easy to read for a barber that is seeking a higher level of knowledge to demonstrate their sensitivity to this population. But that also comes from the group giving us goals that we need to hit as a community. So I wanted to share that. That's where we're looking at. But definitely we at the health department, as much as we would like to be the subject matter experts on every single subject, unfortunately, we, as mentioned in the last meeting, this is done as a community, and we have the strength in the numbers, and we have the better outcomes as participants of the community.
Well, the health department does thrive on the partnerships that we create, and the work that we do, it's not without the people that contribute and that partner with us and move forward with us. I think this is an amazing opportunity to highlight the work that all of you do and create actionable items. So what's great about the structure, or what we're envisioning for the master plan, is that we don't want a document that sits on a shelf or at a web link, but something that we can go back and say, okay, there's metrics. We said we established the expectation that, this was our recommendation. Where are we 6 months, a year from now? So that's what's really great about that. Furthering the conversation about expanding the efforts or the current programs, we have had preliminary conversations with other city departments. Human resources, we do have a representative today in attendance, so we do appreciate the time, so that you can know a little bit more about everything that we do and what this, the value that this committee contributes, as well as with other departments. So right now, guys, the sky's the limit. I think that for a lot of you, a lot of us, we have these, in an ideal world, like this is what we would like to see. This is a time to, provide those ideas, those dreams, those goals, and then trying to structure it into something that's realistic and attainable. So thank you, guys. Thank you. Any other questions?
Regarding hiring people with special needs, I think it's real vital and important that city as well as the county as well as any public institution, the trendsetters, they have to be sure, they need to show the responsibility if they're willing to take that kind of risk if there is one. Just with disabilities. That's a real difficult challenge in any organization or industry. People that individuals with disabilities can contribute, can provide assistance and help to run their own organization. It's always very difficult. So I thank the city, I thank the health department for doing that because it's really difficult. You feel like a hypocrite asking people, well, yeah, I need you to please consider hiring somebody. And say, well, your own city wasn't doing it, so why should we? It's a really difficult challenge. We've been to that before. The city doesn't do it, the county doesn't do it, why should we? And we show the example first. And so that's really important and real critical. So we can always use you now.
As an example. Well, what's great about these programs is that we understand the nature and the goal of transitioning into the workforce. I think that when you start thinking about it in a more global perspective of, well, do you do it? We go back to the self-reporting and self-disclosing. Because this is a protected class, there are some intricacies and legalities of it that we have to consider. We can't just, as much as I know council talked about perhaps some sort of preference or how it could be reported. So then we have to kind of backtrack and say, wait a minute, we have to make sure we're in compliance. So, but definitely, all ideas are valid. This is the time to brainstorm, to think about what our ideal community looks like. So I really hope that you can join us during the coalition meeting or even the town hall meetings that are upcoming so that we can further the discussions.
And just in the past year, we have hired 2 of those participants there. And I think that when I talk to other employers and one of their fears, I guess, is what they're talking about the compliance. They want to make sure they're compliant and they're able to be driving. So I think that if one of our employers talk to others, it's not that big of a challenge to accommodate individuals.
Or even starting off slow with an adult paper experience. Because before it was only the CO, which is on adults. And just this week, I got the news, unfortunately, 2 of my diabetes educators will retire come over. And these have been where I use for my customers that are legally blind or visually impairment, and they need that education specifically with the special equipment that talks to them. And then we have somebody that's interested, a student that graduated, she's legally blind, but she's like, something I would be really interested in becoming a provider, but she's 1 year of experience working in the diabetes education realm. So then I'm like, where exactly? And now that I was like, and then she can get hired.
You can also certify her as a peer educator as well, like by the Diabetes Department Education Program out of the University of Illinois Chicago. Sorry, I'm gonna say the acronym.
But it's been something where she hadn't graduated just yet. I knew just in meeting her and herself how she learned to manage herself, with diabetes. And I thought, this individual would be a really good diabetes educator. And I knowing that some years later it's time for all providers to retire. And I'm like, no, but I know I can ask you. But now I'm in that, step where they were experienced.
And I can also mention, as Ms. Jackie stated, it's important for us to take it outside of this room, but share it with other employers. And just recently at a meeting, and I'll share this so definitely there can be some connections. Mr. Eduardo Garza, who's the owner of Unique Trade, said that he would like to also come on board and start putting putting into action on the private sector. And so he's one of the largest import exports. So I encourage you to reach out to him, and I'm sharing it with everybody. Said it out loud, so I'm making sure to relay the message. Yes. So he did share that with me, and I wanted to make sure that that is another avenue on the private side, that is a large employer that is willing to be on this team.
One last thing that I want to share, as much as we talk about how much, the individual school we place to work are going to benefit from this, I can tell you that the benefit the community will receive and that future generations will be impacted with is greater than anything we will ever see. I tell people that with the work that I do, I don't do it for today. I do it because I'm going to have great grandchildren at every stage who will come to Laredo and they'll know that they have a better place to live and to be around with 100%, not 99%, but 100%. So that what we do here as a committee, we will impact the lives that we not yet see.
So, any other information anyone would like to share under item 6? So I'll move on to the next item, which is item 7, any announcements?
I didn't sign up for anything, but it was, but we're having this, Adventures into the Sea, respite camp for children with disabilities in cooperation with, Autism Development Council. I hadn't, informed of you of this in the other meeting because it was, the date was going to be moved back and forth. But we're glad to be bringing these back. This is a summer camp especially for special needs children. The parents look forward to this event every year. We've been having for the past 3 to 4 years. We're starting out slow because, you know, the epidemic and after pandemic, it's going to be for 2 days. The registration is actually taking place as I speak at the center. It's a fun-packed 2-day event this time. We're having a lot of support and people just calling to be sponsors and be part of this summer camp. It's really a respite camp because it's also for the parents of children with disabilities. They get to have those 2 days where they drop off their children, knowing that they're in a place where specialized licensed staff is taking care of their children. So if you know of anyone, space is limited, but we're willing to go a little bit over as long as we have volunteers. So if you know of anyone that wants to volunteer or in community hours, we're welcoming everyone. And also,
I'm so sorry.
no, that's okay. Christina's also they're going to be participating and helping us with this camp in this manner. Go ahead.
Yeah, so we still have emergency funding available, which we are assisting families that are ODHP, but we've also partnered with Ruthie B. Powell in this camp, respite care camp, to offer the families that are going to be registering emergency funding as well.
So this is going to be great for families. Thank you. So let people know we're going to have this August the 3rd and August the 4th from 10 a.m. to 6 p.m. Thank you.
And I would like to also. We have a mobile health clinic village on August the 5th. This is a back to school health with health services. This is going to be this will be at Sisters of Mercy Water Park, 2201 Zacatecas Street. It's going to be from 9 a.m. to 12 p.m. We're going to have different services on site with the mobile health clinic village. It's going to include food distribution, backpacks, school supplies, Zumba, prizes for the attendees, and an at-home COVID-19 test kits. But I do also know there's going to be several programs that are here at the health department present, like our program, Children, Young Adults, Special Health Needs, on site, so we can, of course, educate and offer resources on site for families. But of course, we have different partners that include the WIC department, Driscoll Health Plan, Gateway, and much more partners that are going to be attending as well to give free resources and services on site. We'll share the flyer with everyone in the committee as well as the attendees, so that if you would like to share it too, it'll also be shared on our social media as well, so we can continue sharing here. But if there's any questions, please reach out to us.
I also have an additional announcement. I think Erica will follow with one more. I just wanted to remind everybody here at this committee to continue to share with all persons, family, social circles, to make sure to report your positive COVID statuses to the health department. Right now, we are seeing an influx, or not significant because we're not getting all the reports. So we're seeing an increase and we're getting reports from organizations that have several members out or family members are out, but we're not seeing that number here at the health department. So our community risk level as defined by CDC is still listed as low. But of course, us at health, if you haven't noticed, we're pumping out a lot of messages about still using face masks, about getting your vaccines, about reporting your at-home test kits to the health department via the QR codes for easy connection to the online forms, or just emailing them to us or calling us, because it's really important that we have an accurate representation in the community, because data drives decision making, data drives response. And as of this moment, we're in green, so we're okay, but we might not be okay. So if I may ask for support to continue to share that, I'll ask Christine to push out the QR code, the email, and the phone number to the group also. So if you have information, as I just shared recently with our staff, my mom came back from a trip, she was positive, and of course I took her information and I sent it over to the epidemiology department, because anybody with information about somebody who has a notifiable disease condition is required by law to notify the local health jurisdiction. So if you do have a family friend or anybody in your social circle that might not have reported it, it's okay for you to report, and it's basic information too, just so that we're getting that data in to drive response mechanisms. So thank you for that support. And there's some more at-home test kits back here for you all to take home as well, with the notion of making sure to report those positives.
Okay, so talking about data driving decisions and response, we are very happy to share that we are in the preliminary stages of issuing out our community health needs assessment. And with that said, I'm going to send it over to my health equity team, who will provide you a more thorough report.
Good afternoon. Yes. I'm a health equity analyst.
I'm Brian Logan. I'm also a health equity analyst.
And like Ms. Martinez said, we are in the preliminary stages of doing partnering up with the Texas Health Institute in regards to health assessment with the city. We've been done since 2011. It's something that long overdue. Dr. Chamberlain has voiced that going forward, he just wanted to say 3 to 5 years. But we are very excited about partnering with the Health Institute. They have conducted some assessments around the state, with a lot of experience. This health needs assessment, like I said, is long overdue. It's going to give us a lot of standard information, disparities and issues going on within the community and surrounding areas. So we're very excited. We will be having our kickoff meeting next week on the 27th, where we have a community team coming in, and so be on the lookout for that. We will find information that it continues to unfold.
Yeah, I was going to say, like, data does drive decisions, and that's the whole purpose of this assessment. So through focus groups, interviews, and surveys, some of those may be pushed out to people that are sitting here today. And our health equity team in the health department just really looks forward to hearing your perspectives on ways that we can look at different communities, and especially people with disabilities that we've been talking about today. So we're super excited to be working on it, and expect updates from us in future BRC meetings about our progress. So yeah, thank you.
So I have a question. What is the word equity? So can you all elaborate what that means? For your specific function.
What I would say is identifying populations and removing barriers to care for everyone. That means that for different populations, they may need more help, they may need less help, and just getting everyone to the same level so that they can access care and at least have the same opportunities to live healthy, fulfilling lives.
It's an issue of accessibility. Thank you.
Remember Mike?
Right.
Okay, because I sit next to him, I get to talk a lot. Just a reminder, February the tenth, everybody write that down, February the tenth. We are having the most amazing night to shine. And all of you have no excuse for not being there because I'm giving you every month, I'm going to remind you. And folks are going to send you emails. No, really, honestly, it's going to be, a challenge, and I say that because I spoke to Eric. I said one of the challenges I have not thought about, my son, who happens to work for an organization in San Antonio called Move Texas, he says, are you going to COVID test all of the individuals? So I looked over and I said, the health department is. And I said, we have plenty of kids. But no, truthfully is we are going to have the Night to Shine is a program where we get in, we gather individuals with disabilities, and they all have to get a chance to have a fun night, regardless of age, from 14 all the way to whatever age they are. I know some of you have been there during those events, and it's an amazing opportunity to highlight a fun time and to leave there with more than we bring in, okay? Because we get to sit with someone and we cater that night. Red carpet, what's it called, those party buses, music, robots with lights. We had a drone one time that flew over the area. I think it's a great opportunity, but it doesn't take one person, it takes a whole bunch of them. So February the 10th, everybody in town. I need dates. Yes.
And people might be.
Yes, definitely. We're ready for that one. Yeah. It is sponsored by the People Foundation and everything. So you all have talents, you have treasures, okay, and you have time. Put it down on your schedule and be part of it. You're welcome.
Any other announcements? No? So before I adjourn, I would like to thank Dr. Chamberlain for being here. You're always busy, so I appreciate the fact that you've been here from start to finish. And while we're here, I know that there's lunch behind me, so you're on as well for that. And again, I don't know, we're having the first meeting for the group on August the 3rd, right? In August 10th. So it's July, so we probably won't have another meeting until after those 2 meetings.
Correct.
So will you also know for this? Okay. Sure. So I'd like to adjourn the meeting. So I need someone to motion to adjourn. I need someone to second. Okay. Meeting's over. Thank you so much.
Thank you.